Dear all, welcome to this second part of the podcast with Mr. Omar. He is Bangladeshi American. He was the former CEO and the chairman of the Medtronic company. Thank you, Omar, for joining with us.
Thank you.
In the second part, I will focus you more on the prevention. First, we have focused on the healthcare system. That is very important system. And now the prevention. Prevention is most important, but it is less focused in our country. And we are the doctor, patients coming to us. We are treating the patient, but we are giving less attention for the primary prevention, like we discussion, and even more important for the prevention aspect is to counseling or give that message to the parents or their relatives. That's important. So primary prevention is very important. So with your vision, how can we implement this primary, how can we improve the primary prevention in Bangladesh? There is a system, but we need more organized system in Bangladesh for the primary prevention of the heart disease. Like hypertension, we have to tell the patient, we are treating hypertension because complication is arising. Don't stop the medication. If you don't take the medicine, then your kidney will be damaged, then your heart will be attacked and brain will be damaged. Then you cannot be active life. So you need a treatment of the hypertension properly and appropriately in early part of the life. So what do you think about that? This is called a non-communicable disease primary prevention.
Good.
Hypertension, like diabetes, like smoking.
Yeah.
What do you think?
Well, I think the first thing you have to think about, even in prevention, is cohorts of people. It's one thing, their age is one, their current status is another one. Someone may already have early stage diabetes or hypertension. You can't treat them the same way as someone who doesn't. And so, a granular cohort is necessary. And to do that, especially in a country like this, early stage health checkups are important, especially in rural areas. Even in cities, but in densely populated
You were
places.
telling about the screening.
Screening, yes.
That's one form of
it. I think it's important to do that. And you put cohorts in and you treat the people differently. I mean, there are programs that I've worked on here and continue to do where community workers are going to villages and going to every patient, every person in fact, and doing basic checkups. Those checkups of blood pressure and diabetes and heart rate and so on. And then these things get sent to the cloud. There are programs there which then assess that and determines which patients are have some kind of disease and which are healthy. And the ones that have disease, you proactively try to kind of manage them, because as you know, you can get high blood pressure without any symptoms. And if you can catch that early, then you can prevent it. And even if there's some symptoms, sometimes they don't say what the symptoms are, and someone goes to ask them, and then they're in another cohort. So I think person-to-person interaction there, and using today's technology where the skill set that's required to collect the data is not that high. You can get high school educated people at very early stage in their job life to kind of do this thing and do basic screening, which is actually easier today because of the way in which data can be transferred and assessed. And in that way you can pick off cohorts who can be managed more effectively, and you can start to drive prevention. I think this is a program that we're actually working on in rural communities. It can be eventually brought to urban communities as well. But I think that's a basic concept of prevention, which is for non-communicable diseases, which is fairly straightforward, but it has to be done. It has to be done with some structure. Algorithms have to be there, follow-up has to be there, and measurements have to be made that yes, this person had high blood pressure before, now it's stabilized or it's gone down. And they have to be done because, as you know, in healthcare, it's not just the first stage, it's what the follow-up is as important as the initial diagnostics, and all of that has to be put in place. And I think doing that in rural communities with cohort identification as a priority, using today's technology, is something that can be done.
Do you think that AI could help that?
AI could help that a lot. I mean, in many ways, through AI, you can, using the data, you can prioritize who to check and who not to check, and it's not just...
That's important. And in Bangladesh, the important thing is that all the patient comes to doctors.
Yeah.
There should be a family physician or family...
Agreed. More than that, I'm saying that community worker,
that's
high school educated.
High school education.
And maybe who just knows how to take a blood pressure measurement and do a diabetes check and just insert it into a tablet.
That is very important. It should be the structured way.
Yeah.
And government should take the responsibility for that.
Yeah, I think the government is interested in that. And
government is interesting,
yes,
but
yes.
government has to be focused in implement that.
Yes, and there are companies trying to do this, and I think the government has to work with them. But you made the very points. Do it at an early stage. Use technology, and the technology is evolving very quickly. There will be a day here where things that are viewed as an area that I know well in ultrasound imaging, things that used to be done in hospitals will be done by community workers.
Yes, that's
using
right.
AI data and using very simple handheld systems. And there are other things that can also be deployed. But the nature of the technology, the medical technology, the nature of the data sort of analytics that can be done, applied on a per patient basis, can make a big difference. And Bangladesh is in as good a situation to do this as any other country in the world. It's not a matter of developing or undeveloped. No one does
That's
this.
right.
And so Bangladesh can lead the world in doing this if it really wants to.
And because we have 2/3 of the active population, that's
Yes.
most important.
Yes.
Because most of the population are active, they can work,
Right.
and they actually generate the revenue of the Bangladesh government. That's
yes.
pretty important. And the important point you said that the community healthcare providers is very important.
Very important.
Not necessarily it will be the doctors,
No.
because when
Early
the patient comes to me and comes to us, like specialists like me or others,
It's very late.
it's very late.
Or they're wasting your time. You don't need to see them.
Yes,
Yeah.
I need to see them.
Yeah.
Even only second time I need to see them. Only
Yeah.
to the blood pressure measurement.
Right.
Patient coming from the villages and come to me,
Yeah.
and that gives the load to the doctors.
Yeah.
But on the other hand, they're charging charges. That's a different issue.
Yeah.
But that is not the way of the treatment. Treatment is that patient can be looked after in locally or community,
Yes.
and that will save money.
Absolutely.
That's very important.
Not
That's
only
the-
save money, it'll improve the person's life because you're catching the
Yes.
disease early.
Yes, that's very important. Another thing is that the non-government organizations can work together
Yes.
with the government, because many of the non-government organizations, I know that they should be interested,
Yeah.
national or international organization.
Yeah.
They should be collaborative with the government and can intermingle each other,
Absolutely,
and
yeah.
we can make it successful
Indeed.
at the remote places.
Because non-government organizations like BRAC and others have community workers who are easily qualified to do this kind of thing.
Yes.
Easily. And there's a lot of interest from those organizations in doing this. And it has to be organized. And there has to be a connection to the government in the end, because the government does have a healthcare system. So when a person is identified who has an issue, they have to go to a system and a record has to be kept. There has to be a digital system there that keeps the record. Follow-ups are done. All of this can be done. All of this can be done, and I do think that doing this from a preventive perspective at different stages of health is the most efficient and most effective way of implementing healthcare at scale.
That's very important. Other part of this, that the food habit,
Yeah,
that's
yes.
important.
Coaching.
Food adulterism, that is like a mixture of the food, some kind of the foods. And
Well, I think what you're saying is that overall behavior change, behavior management is important for everybody. It gets even more important if someone's caught with a chronic disease. Let me give you a little example of something that I was really struck by in many ways. I was at a community center in one of the provinces here, trying to do something like this, and I talked to one of the community clinics. It was a hospital with a doctor there, and it was obviously crowded with a lot of patients there wanting to be treated and all that. We were trying to do this in the villages, but I was looking at what the current status was, and it was overcrowded, and they were complaining that there isn't enough medication to give to these patients. But I also found out that these patients would not leave the hospital unless they got medication, whether they needed it or not. Because the whole philosophy is, I came to the doctor, I need medication.
medication, that's right.
Sometimes you don't need medication, and instead you need behavior change, you need coaching.
Yes.
So this kind of system and thought process has to be put in and has to be viewed as very important.
Yes, that's very important.
We view the availability of medication as very important. The availability of the need for medication and the appropriate need for medication is equally important, but we don't think about it that way. So I think therefore you need an overall look at healthcare, where the health of a patient comes first, educating them comes first, and all of this requires non-clinical work in the way we define clinical.
Yes, because sometimes patients coming to me,
Yeah.
I always try to tell the patient that you have any problem or no problem.
Yeah.
If I said no problem,
Really?
sir, really? Are you sure? Yes,
Exactly.
I'm sure. But other doctor that there is some problem. I cannot say like that.
Yeah.
If you trust me, you have no problem. Are you happy? Yes, I'm happy now. So people does not, most of the patient, but many of the patient doesn't like to accept the word like you have no problem.
Yeah.
They think that I should have some problem.
Yeah.
Or there may be some familial affection, or maybe wife, maybe I have facing this problem, may have wants that his husband has to be take care of the wife very much. That's why she has
to do that.
Take some sympathetic consideration of the
But
husband.
this
That's
is
important.
this is a matter of education. Bangladesh has one wonderful achievement over the last 50 years or whatever. The country has sort of stabilized its population growth, and they did that through family planning and all of that. That's not easy. It was done through education. Let's do healthcare the same way, through education and through teaching people exactly what you just said. But you have to have a whole-scale effort at that, an organized effort at communicating that behavior and improvement in behavior is important. But it has to be thought of that way. This cannot be that you just tell every doctor do this, because the doctors are overloaded. They're right there. There's only so much time they have. And you get a variety of skill sets amongst doctors and passion for doing this. And it's the easiest thing for them is to just give some kind of medication.
Easiest thing, yes.
And that's wrong, but they're under pressure, they've got all these people coming, they don't have time to think,
Because
they just do this.
if you give some medicine,
Yeah.
you can distribute quickly. But if you don't give any medicine, they will be happy. They will ask you so many questions.
Yeah,
so
but you should.
This has to be
changed.
Understood by the patients.
Yeah.
And this
And
is
the doctors.
our responsibilities, their doctor responsibilities,
Yes.
government responsibilities,
Yes.
the school responsibilities,
Yes.
the media responsibilities.
Yes.
Everybody should be work together. Then these changes could be coming.
Exactly.
forward.
So education.
No medicine. I always say to the patient, no medicine is the best treatment.
Agreed.
Yeah. If the doctors say that you not require medicine,
You're in the best shape possible.
you are the best doctor, best hand.
I agree completely. Yeah, I agree completely. I think that's so important, and the healthcare system has to realize that. And you've got to have payment mechanisms which are derived by the improvement of health, not by the amount of medication you sell or what you need. That's the wrong metric. The metric is how do you improve health. And I think you understand it completely. I think you and I are saying the same thing. But that education is needed. And this is not, I don't need technology, I don't need anything else. I need a basic principle and I need to apply it and I need to do it at scale. And this can be done.
So we are at the end of the session, and now we will focus on two important topics. One is that the stop of the smoking and the drug addict. This is very important.
Very important, yeah.
Drug addict is a really disaster in our country, and smoking is also. So
Indeed.
it has to be. And drug addict, it can cause any kind of the disease.
Yeah.
And smoking is also.
Yeah.
This has to be stopped by media, by advertisement,
policy, by many things.
Many things.
Yeah.
And it could be the government kind of policy that it should be stopped.
Yes.
Our community should take the responsibility for that.
Yes.
Get rid of the smoking, get rid of the drug addict. This is very important. Second one is that in Bangladesh, we have a less area of the land. We know that. And we have many more 180 million populations. So there is a less place for an exercise or gym or like that. So there should be some structural format or encourage the community to build up how people can take care of their health, like the walking, like the gym. It has to be started from the school. And many of the school has no land, only 1 or 2, 3 of the apartment, and they're making the school like that. So from this point has to be come out. Maybe there is in that area there is some kind of the land. It could be shared by each other.
Yeah, but also just general behavior. Walk more.
Walk more.
Walk more, do this more, do this. So general behavior, general education, I think can be used. Because in the villages, especially in rural communities, it's not as dense. It's dense, but not as dense as a city. And you walk from place to place. Make that enjoyable. You can even teach people how to do this. But I think in general, at the village level, people are pretty active.
Yes.
I think that's not an issue. I think stopping bad habits amongst them is perhaps more important, like the smoking that you said.
Smoking is the most important.
You shouldn't allow that.
And physical activity they have because they work and they go from one house to another house. They're going to the like that mosque. They go to the madrasa school like that. So they are working or they are going to the farm for their activation.
Exactly.
So they are physically more or less most of them are fit. But most important is that the stop of the smoking important and early detection of the.
Yeah, I think the problem you're describing is not so much amongst the rural population or even the more of the working class. I think they're pretty active. I think it's the middle class where you have a bigger issue, which is a smaller population. But that's where there's a lack of exercise. There's maybe too much food. There you need gyms and you need coaching, and then
Yes.
I think Bangladesh actually, in my view, is, from what I've seen, has made significant effort there. In parks you see a lot of people walking. You see little pull-up bars and things like that, and people do it. So I do think that there is a lot of capability there, and there's a lot of interest, and it just needs to be encouraged, and bad habits should be
Has to
forcibly stopped. But I think in many ways, this is a problem, a potential problem, let's say, that we can get on top of and actually control. Because I do think people in general have a tendency to want to do this, and in the rural communities, they're active to start with. The thing that I would watch is the prevention and more management of the sort of food that's being put over there, and encourage their own traditional food habits as opposed to new food which is not always the best for them.
Okay, that is, you tell that the food consumption is very important. Types of the food consumption.
Types of food,
Like
and
in our
artificial
country,
stuff that you have today and all those things. The natural food that you have is far better.
it's far better. That's right. And
Stick to that.
our habit is to take the more carbohydrate and more sugar. So we have to stop that.
Stop the sugar.
Stop
the sugar, yeah.
Stop the sugar. That's important.
Yeah.
And we have a very sweetener, different kind of sweetener that's very attractive. I also like
You
it.
don't need that.
But we do not need that. But we like it very much.
Yeah.
So thank you, Omar.
Thank you.
I think so. Our discussion will goes to the media,
Yeah.
YouTube,
Yeah.
and Facebook, and it will be ventilated throughout the community,
Sure.
including the healthcare profession. And I hope they will benefit, and hope we will see you again in this podcast.
Indeed. Yeah.
In
Thank
future,
you.
in the different format. So thank you, Omar.
Thank you.
And thank you very much. Thank you for coming here. Thank you for joining with us. That's all. Thank you very much.